Good morning. I'm talking to clinical psychologist Dr. Sam Minskoff this morning. Hi, Dr. Minskoff. How are you?
Good. How are you today?
I'm very well, thanks. Dr. Minskoff, the first question I'd like to ask you today is, what's the difference between a nightmare and a night terror in children?
Okay. To look at sort of, well, in a generic neurological, psychoneurological perspective, it has to do with the stages of sleep. Okay? A nightmare occurs during REM sleep. REM meaning REM meaning rapid eye movement. And the reason why they call it that is because when a person is dreaming, they're actually looking at the dream as if they're looking at any scene in real life. You can see the eyes moving under the lids. You can actually see this in infants. You see the little eyeballs moving back and forth. There's images that are coming that they're following with their eyes. This occurs during there's 4 stages of sleep. Around stage 2 or 3 is we get the REM sleep, where you actually get restful sleep and reduces a lot of the tensions of the day. The night terrors usually occur when it's past stage 3 to stage 4 sleep. And, okay, we'll get to more of that later on, but primarily it has to do with the stages of sleep, and that with the issue with the night terror, the person can all of a sudden, or the child will spring up in bed with eyes wide open, whereas with a nightmare, a person is sleeping, eyes closed, or they're in that, what they call a stage 2 to 3 REM sleep. But a night terror it has to do with, it's related to somnambulism, sleepwalking. Outside of the regular way of sleeping. So again, the same rules apply. Don't disturb. But all right, primarily neurologically, that is the difference. And night terrors are pretty rare, actually. It occurs between 1 to 3% of, say, children. Let's say from 3 to 6, around that age range. It could vary.
And what causes night terrors?
Again, I hate this phrase, but we don't really know exactly. No one has actually really pinpointed it. All we have, actual direct cause. What we have is correlations. When this occurs, that occurs, and it makes one think that maybe there's a cause and effect relationship. It's certainly a correlationship. It has to do, even on a neurological level, the psycho-bio-neurological level, it has to do with transition. Like anything else, when a person you're going from an infant to a baby, that's a leap. But when you're going from let's say a toddler, which is going from a baby to a child, that is a major transition, really. Look what's happened to this individual in 3 years. They went from one completely different world to inside, room, outside to an environment where it's cold and dry or whatever, and now they have to chew and swallow themselves. It's a real, it's a shock. And then there are stages that develop there. Okay, when you're in the toddler stage, which I like to call the first adolescence, there's a major transition going on neurologically, psychochemically in the brain. It has to, in the central nervous system, to be more precise. And also, which is an actually part of the brain, the reticular formation, which has to do with dreams and sleep patterns and things of that like. And it's in transition. And oftentimes, when that happens, these night terrors occur, and they usually pass. Adults can get them too. What causes them, even on a psychological level, or makes a person susceptible to trauma, or some kind of tension that's in the environment, or simply that I'm just telling you to parents that when these things happen, don't sit there and go, oh my goodness, what have I done? What can I do? It's not you. It happens. It's, I don't want to oversimplify it, but it's like acne. The skin goes through a major transition during the adolescent years, from like child, baby, smooth skin to, let's say, in a man, rough skin that has to be scraped every day because it grows hair. Of course, some of us don't have that problem, but it has to do with the transition. There is a disruption, and it's not always a destructive type of disruption, but again, it's rare, and it it does pass.
What can parents do for their children while the child is actually having the night terror? What's the best advice you can give a parent?
You mean during the nightmare or during the night terror?
During the night terror.
Okay, while it's happening, while the episode is happening?
Yes.
Okay, basically what you want to do is you don't want to disturb the child. You don't want to disrupt what's going on. Just be there, write it out, and you want to make absolutely sure that that he or she, the kid, pardon the expression, doesn't hurt himself or herself. Because sometimes there could be frailing going on, and I know the camera makes things look a lot faster than they are, but they could accidentally, inadvertently hurt themselves, and you want to make sure that that doesn't happen. Basically, while they're going through it, they're going through it. Okay, so you got to let them breathe in that respect. Make sure that they're safe. Keep them safe. And by providing a safety environment, whether they pick up on it or not during that stage, will help a lot. It's about feeling safe. When you're in terror, you're not feeling safe.
Thank you. Thank you so much for talking to me today. I really appreciate it.
You're quite welcome. Thank you for having me.